Greetings, students. This is the second half presentation lecture of week 10, and we're dealing with chapter 13, misuse of inhalants and aerosols. And the objective for this chapter is to understand the history of inhalant use and comprehend the pharmacological methods of use, subjective effects, and consequences of inhalant use. So we go to our first slide and we talk about the history of inhalant use. And here, although other substances that are misused can be inhaled, the term inhalant refers to the various substances that people typically take only by inhaling. So the term inhalant does not refer to a specific type of compound, but actually a method of substance use. So people who use inhalants breathe them in thoroughly through the mouth, which is called huffing, or the nose. The 20th century saw the introduction of gasoline and various industrial solvents, which became compounds misused by inhalant users. In the 1940s, gasoline became very popular as a recreational use solvent. In the 1950s and the 1960s, the practice of glue sniffing became a problem. The glue was used for model plane, automobile, and shipbuilding. And as they discovered that the glue could alter the individual's consciousness, well, it became very popular for recreational use. So we know that some of the items that are used are nail polish remover, glue, shoe polish, spray paints and lacquer thinners, gasoline, and lighter fluid are among some of the inhalants most commonly abused and mostly by young people. In more recent years, glue sniffing and gas sniffing has become a widespread problem among homeless street children in South Asia, Mexico, Eastern Europe, and Kenya. And street kids use the inhalants to numb the pain of hunger and cold. So gas and spray paint sniffing is also common in regions in Canada, Australia, New Zealand, and some Pacific Islands, as well as America. In America, Native Americans, Latinos, and middle school age youth are the large population utilizing this type of drug. And so the pharmacology of the inhalants. Most inhalants affect the central nervous system and slow down brain activity. A true inhalant is absorbed through the lungs and passed into the general circulation from there. This is the most effective means. They are categorized by chemical classification form of the inhalants, such as vapors versus liquid, and the type of products, such as cleaners versus adhesives, or pharmacology of the product. And all these compounds are able to enter the bloodstream without the chemical structure being altered, and the concentration used by the misuser is often 50 to 100 times as high as the maximum permitted industrial exposure level. Inhalants are various products easily bought and found in the home or workplace, such as spray paints, markers, glues, and cleaning fluids. They contain dangerous substances that have psychoactive, that means that they're altering the mind, properties when inhaled. Most inhalants affect the central nervous system and slow down brain activity. A person can overdose on inhalants, although the most common way to do is the repeated use although most common is repeated use, which can lead to addiction. So we look at the methods of inhalant misuse. Many inhalants are legal to possess at any age. They're inexpensive, they're easily obtained, and their intense intoxication typically lasts only a few minutes per dose. So all of these factors contribute to the onset of inhalant use at younger ages relative to other substances. I always remember when I worked in the prisons in maximum security where I was a drug counselor, and the most popular jobs had to do with janitorial services because they had access to all these different kinds of solvents, and in the laundry and cooking, and wherever there were areas where solvents, they were popular places where people wanted to work. I wonder why. So we talk about the methods of inhalant misuse, and inhalants can be breathed in through the nose or the mouth in a variety of ways, such as snorting or sniffing fumes, from a container, whatever. Bagging, so this is sniffing or inhaling fumes from substance sprayed that's been deposited inside a plastic or a paper bag. Huffing is used to inhale, using an inhalant, and what you do here with the mouth, and what you do here is you soak the rag stuffed in the mouth. And so fumes from aerosol cans can be directly inhaled or sprayed into the mouth. And also you can inhale from balloons filled with nitrous oxide. There is a strong correlation between inhalant use, depression, and suicidal behavior. So we look at the anesthetic misuse of nitrous oxide and nitrates. And so here, nitrous oxide was discovered between 1772 and 1793 and used for anesthetic purposes in 1844. It is currently on the World Health Organization's list of essential medicines. It often comes in a 50-50 mixture with oxygen. And so the first two anesthetics used were nitrous oxide and ether, along with chloroform. And ether is obsolete as a general anesthetic. It was used because it was used too much as a recreational drug, particularly during the 1920s when they had Prohibition era, and they needed all kinds of substances to get high. So they were first, these three, the chloroform, the nitrous oxide, and the ether, were used as recreational substances. And they're also known as intoxicants. So it is commonly used now. It is only commonly used by dentists and medical professions to sedate patients. The most commonly misused anesthetic gas is nitrous oxide and is able to induce a loss of consciousness and possible death at extremely high doses. Nitric, a negative side effect may include nausea or vomiting, headache, increased sleepiness, and/or excessive sweating or shivering. Headaches can result if a patient does not receive oxygen for at least 5 minutes after the nitrous oxygen has been turned off. So at low doses, misusers feel euphoric, they feel giddy, which means high, and they may hallucinate. So mostly the reason they use it is because they feel intoxicated or high. Nitrous oxide, which we often call laughing gas, is a colorless gas. The gas is inhaled typically by discharging nitrous gas cartridges into another object, such as a balloon, or directly into the mouth. It produces a rapid rush for a short period of time. And nitrates are inhaled, and these compounds function as coronary vasodilators, and misusers believe it will induce or prolong orgasm. Our next slide, inhalant misuse and the DSM-5. According to the Diagnostic and Statistical Manual of Mental Disorders, the 5th edition, known as the DSM-5, inhalant use disorder is diagnosed when people use inhalants like aerosols, gases, nitrites, and solvents for a psychoactive effect. Inhalant use disorder is equivalent to the inhalant addiction, a phenomenon that resembles alcohol intoxication. And children with either conduct disorders, these are people who usually are, experiencing truancy, staying out all night, fighting, exhibiting cruelty to others, involved in vandalism, fire setting, and non-confrontational theft, or an antisocial personality disorder, appear to be at greater risk for inhalant misuse and addiction. And the research still continues in this area, but it is something that appears often in the psychiatric setting along with the substance abuse setting or use and misuse setting. All right, this concludes this chapter. Thank you for listening.